Pheocromocytoma is a tumor. Is a tumor of what? It is a tumor of adrenal medulla. As you can see here, it is a tumor of adrenal medulla. This is kidney के ऊपर adrenal gland का cortex और adrenal gland का medulla. So it is a tumor of adrenal medulla. Catecholamines secreting tumor. Okay, the catecholamines are secreted by chromaffin cells. These are derived from neural crystals. Neural crystals, chromaffin cells, catecholamine secreting tumor. How it brings hypertension in a young patient. That's a typical history given to you. A young patient with hypertension. Okay, as you know, hypertension is not usually seen in young patients. So, two actions: alpha, beta. Alpha stimulation, beta stimulation, because catecholamines. That's why alpha causes vasoconstriction, beta causes tachycardia. So alpha causes vasoconstriction, that will ultimately cause hypertension, and beta stimulation will cause tachycardia, that will cause palpitation in the patient. So young patient with hypertension and palpitation and sweating, these are the triad which is seen in the pheochromocystoma. It follows rule of 10. That is bilateral malignant, 10% bilateral malignant extrarenal pediatric population, 10% seen in pediatric, 40 in familial, and no hypertension in 10% of the patients. Okay, then we have this initial investigation. Initial investigation includes urinary catecholamines, that is measuring catecholamines in urine and VMA levels. Then uske baad confirmatory by plasma metanephrines, by measuring the level of plasma metanephrines. Best to localize is MRI abdomen. Of course, you will see a light bulb sign in the MRI patient, in the MRI of the patient. Okay, also CT scan can also be done, but in pregnancy we usually prefer MRI. In general case also we prefer MRI. Okay, what is the treatment and management of this? It's a tumor. Okay, so have to remove the tumor by surgery. That is remove this tumor by surgery. Okay, उससे पहले क्या करना है? You have to first block the stimulated action. अगर ये तुमने block नहीं किया तो this will further increase the BP. So that's why prepare first. That is alpha blockade, very very important. That will be achieved by phenoxybenzamine. Okay, and uske baad post that we have to go for beta blockade. Okay, why we are not going for beta blockade first? If we do beta blockage first, तो ठीक है, tachycardia तो ठीक हो जाएगा, लेकिन what about vasoconstriction? ठीक है, उसकी वजह से vasoconstriction और ज़्यादा बढ़ेगा, क्योंकि tachycardia जो है वो कम हो गया. ठीक है, so that's why that will cause hypertensive crisis. So we don't want that in our patient. So that's why the order is clear. That is alpha to beta, very very important alphabetical order. कि पहले अल्फा ने ब्लॉक करेंगे, फिर उसके बाद बीटा को ब्लॉक करेंगे, एंड उसके बाद हम फटाक से जो है हमारा ट्यूमर है वो निकाल देंगे बाय सर्जरी. थैंक यू सो मच फॉर लिसनिंग.